Welcome back. It may be easy to guess that during the cold winter months, those who live in poverty have a much more difficult time surviving than in warmer times. All around Namibia, people are struggling to stay warm, while many of the people who live in poverty must choose every day if it is more important to have heat or to eat. One cannot underestimate the reality of how the cold weather hurts and harms the Namibians who live in abject poverty. Now we are joined by Dr. Nelson Makemba to discuss with us the health risks and the effects this extreme cold weather affects the poorest people in our society. Doctor, welcome and thank you so much for joining us tonight.
Thank you very much for having me on the platform.
Now, once cold weather like this hits the country, what are some of the immediate effects for people who live in poverty?
Yeah, if you look at poverty in itself, and of course the people that are living in poverty, first and foremost, they are probably malnourished. They often don't have enough and adequate and balanced diets and food on their tables. So their immune system is somewhat down to an extent, and also it's a season that is where we commonly see cold and flu. So they are probably prone to, of course, developing these cold and flu-like symptoms. And of course, oftentimes means to keep warm are also limited, particularly people living in informal settlements. They might have to make firewood in the middle of their shacks, and that also run the risk of, having their shacks catching fire. And oftentimes, if one shack catches fire, it's not only that shack, probably 3-4 adjacent shacks, to that one also might end up being gutted. People, then become homeless. These are all kinds of, issues that, especially crop up, around this time. Going to bed, they might not have enough blankets. Their kids, might be sickly, coming up with cold and flu, coughing, chest infections, staying out of school. So these are quite some of the commonest things that we see happening quite a lot in incidences, where there's poverty.
Right. Doctor, what is the possibility of, getting frostbite for people living in shacks? Like you explained, some of them even have to make a fire in their immediate environment, or perhaps in the streets in this cold weather, and how can it be prevented?
Frostbite is quite an extreme, and oftentimes it's not something that we see on a daily basis in our setting, I must acknowledge, but it can happen. You see that oftentimes in very freezing cold weather with maybe snow and all that stuff. But it can happen, and of course when it happens, remember by definition, frostbite is basically your skin gets frozen and the underlying tissues. And then of course, for you to manage this properly, it might mean that that person is really that cold that they've got a frostbite. You might have to rewarm their body. And of course, sometimes if the frostbite is so bad, the area might become gangrenous. We have seen in extreme cases people having to be amputated because we can't restore circulation.
Right.
That's quite an extreme, something we don't always see on a daily basis here. And of course, the frostbite can be very painful. You might need to give something for pain in managing these people. And of course, if there's a wound that develops secondary to that, you might need to help with the wound care, give some antibiotics. But like I've said, percentage-wise, it's not something that we see on a daily basis in our setting. I understand it's quite cold, particularly in this couple of few days.
Extremely cold.
Extremely cold.
Unusually.
Unusually cold, yes.
Yes.
But our chances of running into frostbite injuries that might need extensive medical intervention is quite nevertheless still minimal.
Right. Now, we know that with the onset of COVID-19, the poorest of the poor suffer the most. How about the effects of this cold in relation to the threat of COVID-19?
Yes, of course, the anticipation is always that probably in the winter season we are more alert because the chances of us seeing numbers going up quite significantly increasing in the spread and the incidence of people picking up COVID-19 are always anticipated to be on a high during the winter season. And I must say, seemingly this winter season, we are not having it as well as it was with the previous waves. And also, one of the reasons why that is, of course, is because with the inoculations and people having had COVID and recovered from the COVID, then they develop a natural immunity. So what that does to you, it produces the concept of herd immunity, meaning that as many people in the community have had COVID and recovered from it and developed immunity, with subsequent waves, then the potency of the virus somewhat diminish. And we don't really see extreme cases where people are needing hospitalization. And naturally, this is the nature of how these diseases, particularly pandemics of the viral nature, happens. So as we go with time, we see less severity with time until the whole virus basically fades away, or we just get to live with it as any other normal cold kind of setup. And with this particular season, of course, we still nevertheless have to be cautious. We need to mask up, socially distance, sanitize, and of course, take our vitamin C's to boost up our immune system for those that are able to, and of course, rest very well, make sure we are well hydrated. But like I've said, we are seemingly doing far better now compared to where we were last year this time around.
Right. Now, just something that, tends to happen is that people that are poor use paraffin, gas or wood to keep warm in these winter months, and obviously then they don't have proper ventilation. How do the effects of these fumes affect the health of people?
Yes, the data and the studies and research done around that is very limited, but of course it has been linked to increased incidences of picking up and being susceptible to infection, particularly tuberculosis, impaired lung function, probably ending up with asthma, or even to an extent developing some form of cancer. But like I've said, the studies are very limited, and of course, because we also particularly see this happening in more impoverished environment, particularly in the third world, and oftentimes also research is limited in this part of the world. So it can happen that there is a danger, like I've said, to either getting infection, getting lung problems, ending up with asthma or cancer. But the evidence are not as strong to also discourage the use. Sometimes there is really no alternative, particularly to our people that are still living below the poverty line. Yeah. They do have to find a means to keep themselves warm. The idea probably is always to make sure that if you are going to set up maybe fire with wood, when you have set around the fire long enough and you're keeping it a bit warm, maybe to step out of your shack and then get some fresh air. And of course to make sure that at least when you realize you are dozing off and you are really tired and you are about to sleep, make sure that you kill the fire, because if the fire is still burning and you go to sleep, if a paper is there or anything flies into the fire, catches fire, you could find yourself gutted or surrounded by the fire. And this is actually where these whole incidences and risk of seeing a lot of shark fires, particularly in the winter season, are coming from. Yeah.
Well, Dr. Makemba, let me thank you so much. It's a pleasure to host you tonight.
Thank you very much. It's a pleasure being here.
Well, we have been speaking to Dr. Nelson Makemba, of course, on the health risks and the effects of the extreme cold weather affecting people in our society.